Cerebellar function, gait, and station are assessed bilaterally using multiple tests of balance and coordination, including the finger-to-nose test, the rebound phenomenon, rapid alternating movements, the heel-to-shin test, muscle tone, the Romberg test, various stance tests, and gait tests. During the cerebellar examination, it's also convenient to test gait and station. Begin the examination with the patient seated or sitting upright in bed. Do the finger-to-nose test by having the patient touch her index finger to her nose, then to the examiner's finger, and then back and forth. Repeat this with the other arm. Assess the rebound phenomenon by pulling hard on the patient's arm and suddenly letting go. Keep your other hand on the patient's shoulder to stabilize her and to prevent her arm from hitting her face. Repeat with the other arm. Assess rapid alternating movement by having the patient tap her thigh with her palm and then the back of her hand, flipping over and back. Have her begin slowly and then speed up until she's going as fast as possible. Repeat with the other hand. Do the heel-to-shin test by having the patient slide one heel down the opposite shin and back up. Repeat with the other heel. Assess muscle tone in the legs with the patient supine. First, rock the leg gently to relax the muscles, then give a quick upward tug on the lower thigh. Observe how the knee flexes and what path the heel follows. Repeat with the other leg. If muscle tone is slightly increased, the heel will not slide smoothly but will skitter up the bed. If muscle tone is moderately increased, the heel will temporarily lift off the bed and lower in an arc. With further increase in muscle tone, the heel takes longer to lower to the bed, and there may be clonus. In severe cases, the knee may not ever flex, and the heel will remain above the bed. For the Romberg test, ask the patient to stand and put her heels tight together. Have her close her eyes and gently push her shoulder. Continue with a series of standing maneuvers. You may hold the patient's hands to help her maintain balance. Have the patient lift up on the toes of both feet. Rock back on her heels. Stand on one leg and then the other. Lift up on the toes of one foot and then the other. Stand with feet heel to toe with eyes open and then closed. And hop on one leg and then the other. Begin gait testing by having the patient stand up from a seated position while her arms are crossed. First, have the patient walk normally for a short distance, turn, and walk back. Have her make turns both to the left and the right. Now, test several other gaits, including tandem walk, that is, heel to toe, walking backwards, walking on toes, and on heels.